国际的视角，权威的声音，欢迎您收看《第一声音》，我是李欣。随着医改政策的实施和医疗信息化的进程，中国医疗器械行业的变革所带来的巨大商机，正在吸引着越来越多跨国企业的关注。那么，如何在激烈的竞争中寻觅蓝海？如何平稳地实现本土化转型？本期栏目呢，我们将对话瑞科医疗全球 CEO 凯文·赫伯特，听一听在脱离柯达之后，他是如何带领企业涉足中国基层医疗市场的。瑞科是医疗设备行业的新兵，但它同时又是一个拥有100年历史的老企业。2006年末，柯达集团作价25.5亿美元出售了旗下的医疗影像部门。在新东家的庇护下，2009年，瑞科在美国的医疗影像市场获得14%的份额，在激烈的竞争中占据了有利位置。
Eastman Kodak sold its health imaging operations in 2007, so it's the third year. So how's Carestream doing as a standalone company?
Oh, it's been a great 3 years, very, very exciting. And there's a couple of areas that we look at to evaluate how we're doing. One is the culture of the company, and as we spun out from a larger company and became our own independent business, we wanted to have a very fast, very entrepreneurial culture where every employee could feel like they can make change and contribute to the success of the company. And so that's been a lot of work for us, but I think that we've been able to move faster, to eliminate bureaucracy and layers within the company. And we've been able to put a really strong focus on the customer's experience and delivering an outstanding customer experience and making our customers successful and weaving that throughout our culture. So I've been very pleased with that. In terms of financials, the company has done incredibly well. Last year was a great year for us. It was a difficult external environment. The market here in China was strong, but around the world there were drops in capital equipment spending. And yet, even in that environment, we were able to grow earnings 9% during last year. So it's been a great experience.
So how about this year? Do you have any plans for this year?
Further growth and further expansion. So here in China, we're introducing new products. We're expanding our research and development, growing our operations here in China. Between 2008 and 2010, we'll nearly double the R&D that we have here at our research and development center. And introduce several new products to the global market that are developed here. We're also expanding our manufacturing footprint this year here in China. And we've built a shared service center that operates across all of Asia, providing customer service and also providing service and support to our field operations. And so all of these things, along with our local team that serves the China market, are all growing.
So could you forecast the sales in 2010?
Yeah, about 2.3 billion of revenue.
So what's the percentage of your whole revenue actually comes from the overseas markets?
About 70% of our revenue comes from overseas markets, 30% from the U.S.
We know the healthcare reform actually taking place in U.S. and the Carestream won't miss it too. So any plans, any movements?
Yeah, well, I think that the U.S. Is going to be expanding care to a much larger portion of the population. And in order to do that, we're really going to have to control the cost of care. And so our products typically help customers convert from film and paper to an all-digital workflow and to achieve better cost and better quality across an integrated enterprise. And so as the changes in the U.S. market lead to more integrated healthcare delivery, and as they put pressure to serve more of the population at a lower cost, our products really can fit in well and help the customers quite a bit.
去年4月，中国政府公布新医改方案，基层医疗市场迅速成为众多医疗公司开拓的重点。如何在最短的时间内调整产品线，开发高性价比的中低端产品，成为企业本土化发展的关键。
And no surprisingly, China domestic market is huge. So what you can provide for this market?
Well, China has a little bit different challenge than we have in the U.S. So in China, 3/4 of the population lives in rural areas, and there's a goal to increase the standard of living and increase the production out of the rural areas and create a better life for the rural residents. And so a lot of infrastructure has been built out, transportation and communications and things like this. And it's important now to put a solid local healthcare infrastructure in place. And so we've started projects to provide healthcare to the rural markets in China locally, implementing very advanced technologies, but very cost effectively.
Any projects you're going to do in 2010?
In order to provide healthcare locally, you really need digital technologies so that you can have that consultation from experts that are remote from the rural areas. And so we've developed a digital X-ray detector technology. So it looks exactly like a film cassette, same size and fits right into the X-ray equipment, but it's battery operated, wireless, and it's a full digital X-ray detector. So you can take an old film-based X-ray room and very easily with just this detector and a computer turn it into a digital room and be able to have your images read by experts in a tertiary care hospital. And so that's a product that we've just introduced in January, and in the first 3 months here in China we've sold 49 of these systems and more than $5 million in revenue. So it's a big initiative for us this year.
So what's your solution to control the costs?
Well, we focus on very, very cost-effective solutions. So, you know, we try and use the local supply chain and produce products that are very high quality, require very little service and support, and that helps to hold the cost down, but are also very cost-effective and simple, easy-to-use solutions. And then probably the biggest thing is that the equipment cost is only a piece of it. If the equipment can help you to have better workflow and to provide better service, that really helps control the costs.
Can the hospitals in the rural area afford your solutions?
Well, you know, that's actually a challenge because the hospitals can only charge so much per procedure. And so when they put in these solutions, they have to make the local residents aware that there's good health care so that they will come and get procedures done. But you also have to really, really watch the cost of the solution. And we try and put as much in the ongoing operating cost as we can so that they can pay for it as they do procedures with the patients. But, you know, I think that China is uniquely positioned to be able to put out large tenders and to have central Ministry of Health support and support from the regional health authorities in order to put in the capital equipment, because society gets the benefit more than the hospital that buys the equipment, because there's only so much that the rural residents can pay for their health care.
So any fancy technology you're actually doing here in China, you can share with us?
Lots of fancy technologies, sure. Here's an example. We developed a new imaging device for dental, for the dentist's office, which is a small intraoral camera. So you put it in the mouth and it shows you pictures within the mouth. But it's the first ever use of liquid lens technology, and it gives you very, very high resolution, very fast images, but it's also got all kinds of new capabilities that we're going to be introducing from research and development that we're doing here. So we can do, with this imaging device, surface mapping of the tooth, color matching of the tooth so that you can create crowns and implants. We can do oral cancer detection. Gosh, there's many more capabilities, and that's a really interesting new device, unlike anything else on the market, that was developed right here in China.
And there are a lot of small and big players catering to this market. So how are you going to compete with them? What is your competitive advantage?
Lining up all of the processes, you know, from the development of the products and understanding which products to develop through how we implement the products and how we service and support our customers to make that happen is what's going to give us a sustained competitive advantage into the future.
好的，刚才采访的是瑞科医疗全球 CEO 凯文·赫伯特。那以上呢就是本期栏目的全部内容。国际的视角，权威的声音，感谢您收看《第一声音》，我们下周同一时间再见。